Alrighty. Okay, so welcome to the American Academy of Emergency Medicine Women in Emergency Medicine section, virtual mentoring series for osteopathic medical students. So my name is Caroline, and I will be moderating tonight's session. So tonight's program will be recorded and uploaded to AAEM Women in Emergency Medicine website within 24 hours. And the session is meant to be interactive, so please use the Q&A function. You can be anonymous if you want to, or you can just put your questions in the chat. So we welcome and encourage your participation. We're a friendly group and we look forward to getting to know each other better tonight. So attendee, we only have like one person here, which is fine. But if you can introduce yourself, tell us what year you are, tell us a little bit about yourself, get to know each other a little bit better. And I have the privilege to introduce our panelists. So we have Dr. Melody Kashani. She is a PGY1 at the University of Illinois, Chicago. And then we also have Dr. Nicolette Alberti, who is also a PGY1 at University of Illinois, Chicago, representing tonight, University of Chicago. All right. So I'm just going to start with the questions that I have. And of course, attendees, you can ask any questions that you'd like. Again, use the Q&A function or the chat, doesn't matter, but we'll kind of go back and forth with the questions. So ladies, the first question I have for you is, what is something that you wish you knew before intern year?
Mel, do you want to take this? I'm just switching to my computer.
Sure. I can take this one. Okay, so I guess there's two things. I think the biggest thing for me was I wish I knew how hard residency could get. I think I went in there. I mean, obviously, like, be optimistic. Your co-residents are going to help you significantly. But I think at the end of the day, the pressure that you put on yourself to become a better doctor is what's going to make those days hard. But at the end of the day, you're going to be a great doctor coming out of it. But yeah, sometimes you have to deal with really complicated patients. Sometimes you have just really rough days where you're just getting slammed with patients. But you kind of learn to work around that, and you have to learn how to cope during those days, how you can like get home and just kind of like decompress. Either it's with a friend or, with your co-residents. And I really think like nothing really can prepare you for it, which is a little hard. You go in there, you're like, yeah, this is going to be hard, but I guess you don't know how hard until you get there. But I think at the end of the day, it's going to make you a better physician. So just be optimistic and keep having high goals and standards for yourself.
I definitely agree. I think that finding ways to cope is essential to like managing residency, whether that be like that you like need to decompress on your own, and just like recognizing your needs, I think is so important. And if that's like getting you to go out with your friends even when you're tired, because it will like revitalize you, then you need to do that. But honestly, I think that I wasn't expecting how busy residency would be. Like, I understand that like obviously it's super busy and we all know that, but there's just like so many things that you end up having to do that I went grocery shopping yesterday for the first time in 3 months. And I was like, wow, look at me. I am an adult again. So I think that like balancing those things is like something that I wasn't expecting to be overwhelmed by. Like, I think that we all expect the medicine, but like that, like balancing life stuff, I think can be hard. And like finding a good way to do that and giving yourself permission to not do the things that don't absolutely need to be done, I think is a good way to like approach those things.
And just putting it out there, I go grocery shopping once a week. So that's just, it's just Nikki. So, yeah, but make sure you feed yourself. Yeah. I think like another thing that I wish I knew was that it's okay to not know things, and just giving yourself like that courtesy of like, all right, I don't know it and it's okay. And like, you'll realize that your other co-residents are also sometimes clueless about certain things, and it's okay. It's okay to ask for help. You're not stupid. You can ask these dumb questions, even though they're not dumb. It's better you ask it now than when you're attending by yourself one day.
And I think that we think like always, if someone asks us a question and we don't know the answer, that we think, oh, they like think I'm dumb or whatever. But like, I think that time and time again that happens. And then I get to the end of a shift with an attending and they're like, wow, you did great today. And I'm like, but I didn't know that answer to those 3 questions. And they're like, I don't care. It doesn't, like, those things don't matter. Like, if you're a good person to work with, I think that like the rest can be taught, and that's not a big deal.
Thank you, ladies. That was great and very informative. Okay, so the next question I have for y'all is, what was the most difficult challenge that you faced in your intern year, and how did you navigate the process? What was like your most difficult day, if you remember?
I would say I have 2 answers to this, I guess. The first was like just moving to Chicago. So residency, obviously, like a lot of us do big moves. I moved from Philadelphia and didn't have any family here. So I think at first that was really hard because like you like develop these like very quick friendships, but like those aren't as deep as the ones that you like have had in the past. And like eventually they'll get there. Like Mel and I are great friends, but like at the beginning you're like, I don't know what's going on, and like it's a lot of new stuff. And so I think that that was a little bit overwhelming. And like just like kind of jumping in and like leaning into those new friendships, I think was really helpful. We both moved from somewhere else and like didn't have anyone here, and like we are great friends, and we have like a lot of other friends in our program and a lot of really good mentors, and like your program is there to support you, so like lean on that as much as you want. And they really are like so excited to see you. I remember as an intern, I'm like, oh, they just are thinking that I'm just an intern, but like we were genuinely excited to meet the new people coming to our program. And so like we're so happy to have everyone, and like you should know that your program feels the same way about you. And then the second one, like actually on a medicine perspective, I had a case that was really hard. It was like a postmortem C-section, and we lost mom and baby. And so like we had every attending and every doctor in the emergency department that day was in this case. And so when you like, so that's really hard in itself. And then you come out and you have a whole department that hasn't been seen in a whole hour. So like the department's on fire, and like I think that really recognizing that like taking a minute to assess your needs and like walking away, taking a minute to breathe, like no one is gonna die. Like no, all of those other patients can wait a second. Otherwise, someone would have come and got you before right now. And again, like leaning into those friendships, leaning into like debriefing and like understanding what went on, and like just knowing how you process, I think really gets you through those hard days. Like knowing that there's always someone you can call who will listen is really important.
Yeah, I second everything that Nikki said. She made a lot of good points. For me, I think there were like a few things, I guess. For example, being on nights for like CCU, for example, Nikki can attest, like she saw me cry I cried to her literally at like, we had like some critical care day, and I was just like, I'm so tired, Nikki, like I'm just so tired. And it's like night shifts can be so isolating, and especially when it's an off service rotation. So I think I had a really hard time because I went quite a lot of shifts in a row, not on purpose, I guess. It was accidentally planned because it went into my next block. And I just was exhausted. And I think I was just mentally just really checked out. For me in that moment, Nikki was my shoulder to cry on, and I really appreciated that. And I think, you know, we have our group chat with our other friend, and we just vent, and it's nice. You know, you have that support, like Nikki said. Additionally, I want to always remind you guys that while you're in residency, your life outside of medicine doesn't stop. You know, I went through a breakup. My uncle passed away literally 2-3 weeks ago, and I found out about it, and I went to shift like 2 or 3 hours later. But you know, it's life. And did I have to go to shift that day? Probably not. I could have definitely like called leadership or, you know, someone else and just let them know that maybe it's not a good idea for me to go. But at that time I felt like I just need to like keep my mind preoccupied. which maybe is not the healthiest, but, looking back now, it's just, you have to figure out ways to cope. And then, I'm having my dad fly over here so I can spend time with him. So don't forget your family. Your family is your number one. Friends for sure, outside of medicine too. It keeps you sane. Because, if you're just living and breathing medicine all the time, it's also not very healthy.
I think that also just speaks to like making sure that you surround yourself with people that like will understand in those moments, like that know what to do or like know to ask, or just like who will understand. Like I was saying this to our new interns today, actually, like because we had plans tonight, and one of them was like, "Hey, I can't come. I'm just like so tired." And like surrounding yourself with people who will understand like when you need to cancel, or understand like just like that you need to vent, or that you need silence, or that you need advice, just like surrounding yourself with people who understand that medicine is hard, and like communicating that to your family because sometimes they don't get it. Just surrounding yourself with someone who, or like some people who will, I think is really important, because when your family's like, hey, you have a vacation, like, oh, you're just going to use it to like lay down, and like they don't understand that like that's really important sometimes, and like having people who can empathize with that is really helpful.
Thank you guys. I really appreciate your transparency. I know that just residency can be so isolating. And I feel like sometimes, even in medical school too, you kind of just feel like you're the only one who's struggling. You're the only one who's going through something. But then the minute that you open up to your peers, you find similarities. They're feeling the same way, and it makes you feel better that there's someone that can actually empathize with you. So
Definitely.
all right, so do you guys have a mentor, or yeah, if you could, do you guys have a mentor, and how did you connect with one? How did you find one?
Do you want to go first, Nikki, or do you want me to? Okay. I have multiple mentors, I think, just throughout life. And I think they always tell you, like, you're going to have like multiple mentors because you need one for every stage or everything that you do. But yeah, our residency program is awesome in that they give us a faculty mentor. And then you also have a senior mentor as well. So we like right off the bat connected, and she is amazing. I love her so much. And she's like, let's go grab brunch. And I'm like, yes. So we like grab brunch. Just, Dr. Port.
Oh.
Who's amazing. Yes. And she took us out to brunch, and we just talked and vented about like everything, like opened up, like, like sometimes you think like attendings are like, oh, like a little scary. You're like, oh my gosh, but then they're like human too. And we're talking about like relationships and other stuff. And I'm like, this is so nice, So the program really helped me in that aspect. And then I have like my own mentors from like medical school, for example, that I touch base with, and like just from scribing as well, that I talk to every now and then about just like the job industry and in Florida versus, other places. And I think it's good to have some, and you just go be a normal person outside of the hospital.
I think that I actually was worried about this coming into residency because I don't know, my med school class is really big, and I just am a person who hasn't had a lot of like one-on-one mentorship through this process. And I was like, what the heck is going on? But I do think being assigned a mentor is really helpful. But I also just think like when you get along with an attending or like a co-resident or someone who's like a year or two above you, like just like ask them to hang out. Like usually people are like happy to give advice, and like that's how I ended up with my mentor. She like asked me at the end of a shift, she was like, hey, we get along really well, like would you be okay if I asked them to be your mentor? And I was like, yeah, absolutely, you're great. And like I have my like faculty and my resident mentor, but also like I have a bunch of other like faculty members that I like really look up to the way that they practice. And so like I'll go to them with questions, and like there are other residents in my like, because I'm a combined resident, like that in my program that I like really look up to, that I ask questions for. And I'm like, I joke and I'm like, you're going to be my mentor whether you like it or not. But like I really do like lean into those, and they're really great. And so just like picking doctors or other people in your life that when you look at them, you're like, wow, I would love to be like them. And like just making those connections, I think is huge. And so I don't think it has to be like a formal thing. If like your program doesn't do that, like just pick people that you like admire and you find inspiring. And like usually those people are happy to like help the next person along, especially in EM.
Yeah, and it doesn't have to be like a formal like, will you be my mentor? Like I feel like that relationship just like builds over time on its like by itself, you know, when you're asking questions and then you're like, oh, I really like this practice style, like how can I like form this like you do? And then they were like so happy to help. Like Nikki said, EM, we're the best. We're the best. The people are great.
All right, so I'm curious, like, how is y'all's like intern schedule set up? Is it like you mentioned blocks? Can you go more into depth about that?
Yeah.
You want to go because mine is weird.
Yeah, so she's EMIM, but for ours, we have a MICU block. We have, so that's like 4 weeks, CCU, which is also 4 weeks, cardiac. Then we have peds emergency medicine, that's also 4 weeks. Trauma, which some of our interns get 2 months of trauma and some get just 1 month of trauma. And that's just how it goes with our program. I only had 1 month of trauma and then I had like an extra month of emergency. And then what else am I missing? Ultrasound and EMS month, which is also 4 weeks. And then the rest are emergency medicine, right, Nikki? Did I miss any of them?
That seems right. I think that's all of them. But like pretty much all of our blocks are 4 weeks and then you switch. And then our program is a little bit unique in the fact that we are at 5 or 6 different sites.
Mm-hmm.
So like our EM blocks are a little bit different. And then we do 18 shifts a month. And I think we get a shift reduction no, okay, we don't get a shift reduction.
No, our program does not do shift reductions each year.
So it's like 18 a month. And they're like 8 to 10 shifts or 8 to 10 hours, which I think are pretty reasonable and now like pretty standardized in EM. Like I don't think there's a lot of programs that still do 12s.
Yeah, but our off service, for example, you'll have 12-hour shifts and sometimes that can become 14 hours or like for trauma, for example, 28-hour shifts. Obviously there's call rooms where you can sleep, but sometimes you have sleepless nights. So I think the biggest thing about interning is the off service rotations that just like tire you out. When you're on emergency and you're having the best time and you're learning what you want to learn. And don't get me wrong, like the off service rotations are very helpful. Obviously in your practice, you really do get like a full picture of what you're doing. But you know, it's not the hours that we like. We obviously like shift schedules, and when you're on an IM schedule, I mean, obviously I know Nikki likes IM, so I can't really go into that, but
that's okay. It's not for everyone. I understand.
Yeah.
It also is just like, it's different. There's a reason that I love medicine and there's a reason that I love EM. And when I'm on medicine for more than 2 months, I'm like, oh gosh, I am so ready to go back. And then I like feel the same way on EM. I'm like, wow, I am ready to be on medicine again. So
right. But I know some programs, and I think this is like one thing to look into. Some programs do anesthesia month, some do an ortho month, some do what else? What am I missing?
I know some of them do like overnight admissions for like medicine. Like one of my friends in Philly is on like nights for medicine, and I'm like, what the heck are you doing? Oh, did you say OB?
Oh yeah. Oh, sorry. Yeah, we also do an OB 4 months or 4 weeks of OB as well, where you get like your 10 deliveries and do some clinic work. Thank you, Nikki. I knew I was forgetting one.
And how many years is the EM program and then EMIM?
My EM is just 3 years for us.
Okay.
And then EMIM is 5. And then obviously some of the EM places, like not our shop, but some of them are 4.
Yeah.
Yeah, I didn't even know that. In my mind, it was always just 3. Like, I just found out, like, a couple months ago that they're actually 4-year programs for EM. I had no idea. So,
Yeah,
yeah.
I think they're like kind of doing away with them.
Mhm.
I don't know. I think there are very different mindsets about like 3 and 4. I don't know. I'm going to be honest with you. As a person who's doing 2 residencies and 5, I don't think you need to do 4.
Yeah, I guess it's just your preference. And then I think, yeah, I remember when I was going through the process of applying, I was like, oh, I don't care what rotations I'm doing. I just want to be in residency, you know? But there is some value into looking into what each program does for their intern year and then their second and third, well, third year is all EM, but for their second year as well. I think regardless of what program you go to, you're going to be trained well, you're going to be prepared. It's just a matter of, you know, what is your preference at the end of the day? Do you it's kind of hard to assess as a medical student, like, is my intubations good enough? Are they good enough? Should I get an anesthesia rotation, you know? But regardless, like, you're going to be intubating under emergent conditions, so you're going to get used to it one way or another.
Also, just like something that I like didn't really know a lot about and didn't really know how I felt about it until now is like thinking about whether programs have like graded responsibility or not. So 2 things. One, I have a friend who's like in a program who like she hasn't intubated all year as an intern because she has to do an anesthesia rotation before she's allowed to intubate. And then just like second year is the year that like you are the airway resident and you like are always doing all the intubations. And then some programs like have a graded responsibility where interns take like less sick patients and senior residents take like the sicker, higher acuity patients, which I think sounds nice as a med student, but like what you want to be there to take care of sick patients. That's why you're going into this field. And I would go crazy if I was only taking care of like level 4s and level 5s. I like you get your joy in like I don't know. I obviously can't speak for Mel, but I would be shocked if she didn't agree. Like there is so much joy in like running a resuscitation and you're like, wow, I had that. Like I knew what I was doing. I was like confident in what I was doing. And you're like, wow, I'm like a whole doctor. This is amazing. Like it's what you want to be doing. And so, yeah, we've been saying a lot of stuff about like residency is really hard, but there's a lot of joy in it compared to being a med student because you're like, this is what I want to do with my life.
And you're taking full ownership of your patients. I think
Absolutely.
that's the biggest thing. But yeah, like Nikki said, like it's all preference at the end of the day, but I was the type of person that I just wanted to be thrown into a situation so that I'm exposed to the craziest things, and so that when second year comes around, at least I've seen it once or maybe twice, and feel pretty confident going into it. With all that being said, though, it's not like you're just thrown in there by yourself. Like the attending's always there, especially as an intern, and just making sure that you have like someone to lean on. And if they sense that you're not comfortable, then it's okay. Like people take time to grow, but like in the back of your head, you're gonna be like, okay, next time I know exactly what to do when that patient rolls in, and it's not, you know, it's gonna be your patient. So yeah, something to look into. I definitely did not know that existed either until I came here, and I remember asking orientation, I'm like, oh, do we pick up certain patients? And they're like, nope, you can pick up anyone. I was like, oh my god. But it's been good. It's been good. So. But like
Also,
I said,
knowing when to ask, like if you are uncomfortable with like doing a procedure or like when you're like falling behind, I think that is like that's terrifying to ask, especially as a new intern, to be like, hey, I'm drowning, because like I don't know, you like come in and think you're gonna run the room. I guess you're just like you expect to be able to do like the things that the seniors are doing, I think, because they're like trying to prove your worth, I think. But like you're an intern and everyone knows you're an intern. They know you're going to need your procedures supervised. Like they know you're going to not know things. So like if you are like really behind on your patients or really behind, I like remember like 4 or 5 months into intern year, I started saying, hey, I'm like really behind. Is it okay if I don't pick up this patient? And most of the attendings are happy to let you do that. And I think like asking for help when you're struggling is really important. It is really important to not stay in a zone where you're like super comfortable and like everything is done perfectly on time, because there's like, we talk about this in our program a lot, like a zone where you're like uncomfortable but learning, and then there's a zone where you're like uncomfortable and unsafe, and realizing when you're like getting to the edge of that uncomfortable but still learning and like crossing over into unsafe is really important, and you need to speak up in those times, and like no one is going to judge you for that, and if they do, then like that's probably an attending specific thing, but I think that that's a really important skill to learn.
Okay, so my next question is, before intern year started, after graduation, did you guys do any form of studying or preparation before residency? Did you just kind of go into it? Yeah.
Oh gosh.
Please don't do it.
I don't do it. Don't do it. Like nothing can prepare you for this. Like you just have to be thrown into it. I don't know. I feel like I maybe like tried and then I was like, but it's fourth year. Like I could just relax. And like everyone was like, don't do it. Like everything that you're learning now, you're gonna learn in like a day in residency. Like, and plus, like, I don't know about you guys, but I think like emergency physicians, like they learn when they do stuff. Personally, like I can read all day long, nothing's gonna stick until like it hits me in the face, at shift. And honestly, it's been working out great. Like I've learned so much on shift, and that's where the bulk of your learning is going to be. And on top of like obviously reading outside of shift, but that's your responsibility at the end of the day.
Yeah, please don't study. That's all I'm going to add to that.
Yeah, enjoy it. Enjoy your time. Like I went skiing like twice. Just like beach trips. You're going to be so busy, and when you start residency, it's just not worth it.
Okay, I have a question about complex level 3. So when do you take that? Because I thought that you took level 3 during your intern year, but then I hear that some people, depending on whatever program they're in, they take it like their last year. So does it differ, depending on where you go?
I think it definitely differs. I know there are some programs that have like specific dates that you have to take it by, or they will like pause your rotation. So if that's you definitely have to like ask your program. For ours, I don't think there's a specific time that you have to take it, but you have to take it in order to moonlight. So if you like want to do moonlighting, you have to take it probably earlier, but then later. But I think in EM, you're like poised pretty wonderfully to take it. Like I don't think it's difficult to pass level 3. I don't know, but like I haven't heard of anyone who has failed, and I have a friend who studied for like 3 days.
Don't do that, guys.
Please don't study for 3 days, but also like I don't think it's something, I think we make it into a bigger deal than it probably is. But I think that taking it during your first year is probably pretty reasonable. Or like the beginning of second year.
Yeah, our residency program doesn't have like a hard time to take it. I know some want it done by I remember some programs wanted it done by like the December of intern year or like the summer before second year. It depends on the program. For us, it's more so if you want to moonlight, you get it done, like Nikki said. Additionally, I know like psych residents who took level 3 and they are surrounded by psych patients. So they barely are in like the emergency department or in the hospital to see like basic medicine, I guess you would say, and they passed fine. And at the end of the day, I think if you wanted to do fellowship, your level 1, level 2, your step scores matter more than your level 3. I think people got into their fellowship and then they were like, oh, just for formality, like what was your level 3 score? Like just to make sure that you passed. So it doesn't really matter. Just do your best, get it over with. Which
you guys still have level 1 scores?
I don't know.
So they just changed that so I'm class of 2023. We were the last class to have it scored. So from class of 2024 onward, it's pass fail. Yeah, but step 2 and level 2, they're still scored as of right now. I don't know if that's going to change in the future, but as of right now, it's still a score. So everyone's saying that like, oh, level 2 is going to matter more and all this stuff.
No one can know what's going to matter more. Like we're not there yet. Like you have no idea. And I don't even think talking to our program directors, like they don't know what it means either. Like, I don't know. It's all speculation.
Kill your away rotations. I think that's
Yeah.
the best. Show your true like skills and the person that you are, how awesome you are. And I think that's going to go way farther than scores.
1,000%. Especially in EM.
Yeah, I was about to say maybe not like plastic surgery, but like, but you know, emergency for sure.
And are you guys involved in any like long-term projects or research or anything like that?
So I think that first year really should be more about like you learning how to be a doctor. That being said, I am involved in like some extracurriculars, mostly things that I haven't started on my own. Like I haven't published anything this year. I am working on a QI project very, very, very slowly. But like I think that first year should be mostly focused on like you learning to become a doctor.
I did like a poster. It was like for ACEOP, ACOEP. I knew I messed that up. But it literally just like kind of the situation just kind of fell into my lap and it worked out as just a quick little poster. And I think like each program does want you to do like one sort of research project or poster. But you know, like Nikki said, just focus on learning your first year. You have so much on your plate. Just be easy on yourself. Residency is not the time to like pick up on a million things unless you really want to, unless it's going to bring you joy and bring you like that wellness that you need. But otherwise, I think a lot of us are just tired. We just
I think the like extracurricular stuff is like stuff that I'm like genuinely interested in like integrating into my like practice, like street medicine stuff and like free clinic stuff. And like it really does bring me joy, and I would not be doing it if it did not.
Yes.
All right. And do you guys have any resources that you use intern year as far as like booklets or articles or any websites that helped you kind of
The EMRA antibiotic guide. That thing is like my life. I am obsessed with that book. Also the like PEM book that EMRA puts out. That one's super helpful. And then honestly, I like use WikiEM a lot, like on shift. Like I have it pulled up every day.
Up to date as well. And then Core Pendulum, which is with MRAP. It's like their own separate textbook, and it's like super easy to read on like certain topics that you see on shift, and like you want to look at it. They have videos, they have podcasts, they have like the textbook Core Pendulum is part of MRAP. But like listening to those podcasts on your way to work or something, those are super helpful, and they're short, and they are they're on point for sure.
Okay. I don't think I have any more questions left, but do you guys have any like last like tips or anything, any advice that you could give us?
Oh, I'm also going to add Rosh for your ITE.
Oh, yes.
If like doing like, so some programs have different like meanings for what your scores on your ITE means, and like that can like get you into different rotations or like moonlighting and stuff. And like I think most of the time during first year it doesn't really matter, but remembering that like clinical knowledge and like test taking knowledge are different. I did not do well on my ITE, and again, it does not matter like as a first year, but remembering that like Rosh can like really like cement your knowledge, I think can be really helpful. And then I'm gonna need a minute for my summarizing thoughts. So Mel, go ahead.
Yeah, I was thinking like the biggest is for like M4s right now, for example. Is that what you're asking for you guys right now?
Yeah, for M4s or even just any last minute things about interns or people who are about to start residency.
Don't stress out. I think residency is significantly better than medical school, because you're actually treating patients and you're actually making a difference and you're learning along with it. And it's exciting. yeah, it's tiring sometimes. Yeah, sometimes I want to cry, but that's okay. Like that's healthy coping mechanisms. And I think at the end of the day, you're gonna be a great doctor. Just put in the work, you know, don't be lazy. I think as long as you are interested in what you do and you're motivated to learn, you're going to do excellent. So don't be discouraged. You're not going to know everything. Even our attendings don't know everything. They look up stuff all the time. And I think that was the biggest shock for me. I was like, wait, what? I was like, they're using up to date. It's like, yeah, duh. We're all human. You know, you're not going to know everything, and that's okay. So just be kind to yourself.
I would echo that. I think that just like having the same grace for yourself that you would have for any of your friends. Like, I sometimes think this, like, where I'm like, oh, if like Mel was going through this, or like one of our other friends, like, how would I like respond to them? Like having that grace for yourself, I think is really important. And then just like letting like your attendings and your patients see how like excited you are to be there. Like, this is like where you've been aiming to be your whole life. Like, I was thinking today that like next week I will start like my 20th year of education. Like, this is the goal. Like, really like leading into that, which I've used that phrase like 1,000 times tonight, but like this is where you wanted to be, and like recognizing that and like just sitting in it is like really helpful, and it makes you a better doctor. It makes your patients like appreciate your care more, and like makes those connections more meaningful, both with your colleagues and with your patients. And like that's what we're all here for. Like, it's, being a doctor is a privilege, and I can't echo what she said more about like residency is 1,000 times better than medical school.
Yeah, it is. And then like one other thing I think is important. I had an attending tell me, if you write down two things that you saw on shift, every shift that you go into, and look those two things up, you're going to become such a better doctor from that. And honestly, like it kind of makes it less overwhelming, because sometimes I come home from work and I'm like, oh my God, like I have to study, I have to do this. And then I realize like, okay, let me just pick two things that I was a little unsure about. Let me look that up. And it kind of sticks with you, right? Because then you'll remember that patient, you'll remember that scenario. And so far it's been working out pretty well for me. Maybe I don't do it like every shift, because sometimes you're tired, but but if you can do that as much as you can, I think you're going to be so much better for it.
And you guys are going to be great. You're going to stress, but like we said before, like you are never the only person that has a feeling, like whether that feeling is that like you're not smart enough, or that you're like aren't meant to be here, or that like they're going to take your acceptance back, or like whatever. Like, everyone is having the same feelings, and like you're supposed to be here, and you're going to all do great.
All right, thank you so much, you guys. Please join me in thanking Doctors Nicole Alberti and Melody Kashani for sharing with us tonight. Thank you so much for attending the session. We're always interested in your feedback, so as you leave the webinar tonight, please take a moment to answer a few short questions in our survey. And please join us for the next WIEM session to be announced, I think sometime next month. So to register for this and other upcoming sessions, please visit the website and select the appropriate links. Again, thank you so much for joining us, and we look forward to seeing you guys soon. This now ends tonight's program. Thank you, and good night.